Welcome to Earth Mind Love. My name is Oluwatoyin Ibrahim. Today we'll be talking about painkillers, and we have various type of painkillers, and one of them is what paracetamol, diclofenac, and neurogesic, and ibuprofen. We have different type of painkillers, but today we are going to be mentioning starting from one of the most commonly used painkiller, which is paracetamol. And today, before we proceed to painkiller, we need to understand about the pain. What is pain? Pain is what uncomfortable feelings we get when our body is not right. And pain is can feel like aching or stabbing or throbbing. Is a body way of telling us that our body is not right. Imagine when you touch something hot, pains make your hand to peel away from it. And when you have an headache or toothache, pain tells us that something is not right. Pain is not always bad, it's the warning signals that protect us. And today we'll be proceeding to one of the most commonly used painkiller, which is paracetamol. And today we are going to be analyzing the paracetamols, how it's being used, the brand name, the classification, dosage form, and available strength. And we have brand name paracetamol. We know that it's most commonly used paracetamol and it's most safest paracetamol. And we have brand name, one of the most common brand name. We have the Panadol, we have the Enzo paracetamol, we have M&B paracetamol, and we also have classification. One of the classification of paracetamol. Then we have in therapeutic class, and we also have pharmacology classes. The therapeutic class is used as what analgesic, which is painkiller, and antipyretic, which is used against what against high body temperatures. Pharmacology class is non-opioid analgesic. That means it's not what it's not addictive. And we have the dosage form. What are the dosage form of paracetamol? We have paracetamol in tablet, we have in caplet, we have in syrups, we also have in injections with IV paracetamol. And what are the available strengths of paracetamol that have been produced? We have it in tablet, which is 325 milligram. Is most combined, is most we usually find it together with ibuprofen, usually combined with ibuprofen. We have it in 500 milligram, and we also have it in 600 milligram, and we also have 1 gram, which is equivalent to 1000 milligram. And we also have paracetamol in syrups, which is 120 milligram per 5 ml, and we also have it in 250 milligram, which is per 250 milligram per 5 ml. And we also have it in injection, which is 1 gram per 100 ml. And we also have it in suppository, which we know that is one of the dosage form that is inserted into the what vagina or anus. We have it in 125 milligram and 250 milligram and 500 milligram. And what are the pharmacokinetics of these paracetamols that we have here? We all know that pharmacokinetics is when what body does to the drugs. Now, what our body does to the paracetamol is that it is rapidly absorbed from the what gastrointestinal tract. That means in our stomach, our intestine is very absorbed from our GIT, and we have the metabolism. It is metabolized in our liver. You know that most of our drug it is metabolized in the liver, and through the what it's metabolized through glucuronidation and sulfations. And we have excretion. How does our body eliminate this paracetamol? And our body eliminates paracetamol through what? Urine. And before our body even excretes the paracetamol, what process does our paracetamol goes to? What are the actions, the mechanism of action does it undergoes? And which is this mechanism of action of paracetamol is that paracetamols work by blocking prostaglandin production in the central nervous system, which is in our brain, and mainly by through blocking of what of cycloogenase, which is cause activities in the brain. That means it blocks the prostaglandin production in our brain. Thereby, once it stops the prostaglandin production in our brain, and thereby through the blocking of this cycloogenase, our body, which results in what in relief of pain and what also high body temperature. And what are the duration of action? The how can our paracetamol last long in our body? Paracetamol is last less than what? It lasts for 4 to 6 hours in our body. What are the uses of paracetamol? The various uses can use paracetamol for mild to moderate pain, and we can also use it for fever, and we can also use it for headache. And paracetamol is also used for toothache and also what menstrual pain, but it is not useful. It's not used when you have inflammation in your body. And what are the side effects of paracetamol when you use paracetamol at normal dose? But because all drugs are poison, but when you use it at normal dose, it's not poison. What are the side effects you can encounter or experience when you use paracetamol? We have nausea. That means 5 to 10% that you are having urgent to vomit is based on the data post surveillance marketing. We have 5 to 10%, and the mid rash is about less than 2%. And because mid rash is very rare, it's not commonly in paracetamol. And we also have dizziness is about 3 to 5%. And what are the adverse effects of paracetamol when you use paracetamol more than required dose? And one of the adverse effects is liver damage. That it can damage your liver, and it's also cause severe allergic reaction. But severe allergic reaction is not, it's rare, it's not mostly common. And what is the maximum daily dose of paracetamol? The maximum daily of paracetamol is about 3 to 4 grams per day. And how can we take paracetamol? How to take paracetamol? Is paracetamol, does it affect food or not? Paracetamol can be taken with or without food. You can take paracetamol before your food, or you can also take it after your food. The food does not interfere with paracetamol metabolism. And we have drugs that can be used with paracetamol. What are the drugs that are safe for paracetamol? And most especially that they usually combine together in the hospitals or in the pharmacy. And we have one of them is anti-malaria drug. You know that sometimes when you have malaria, you are mostly given what? Anti-malaria drug and paracetamol. And what are the safest drug that can be combined with paracetamol? We have anti-malaria drug, we have artemether, lumefantrine, we have chloroquine, and we have choline, and we also have sulfadoxine-pyritamine, and we also have antibiotics. Antibiotics like amoxicillin, which is the first line for antibiotics, and we also have azithromycin, metronidazole, ciprofloxacin, and we can also administer paracetamol together with NSAID, with non-steroidal anti-inflammatory drugs like ibuprofen, diclofenac, and aspirin. But aspirin is mainly for short-term is used for short-term pain, but you should not be using it for prolonged term. And we also have antihistamine and cold medicine. You know that when you're having cold or catarrh, you always see paracetamol and diphenhydramine, or paracetamol and chlorpheniramine and loratadine. They are safe with what? Antihistamine and cold medicine. And we also have antihypertension. Paracetamol is also safe with anti-hypertension like amlodipine, losartan, lisinopril. And what about anti-diabetic? Paracetamol is also safe with anti-diabetic, no interaction, and with metformin and glyperamide and many others anti-diabetic drugs. And what are the drugs that should not be combined or should be used with caution when taking paracetamol? And which is number one is we have alcohol. If you know that you are alcohol abuser, you should not take what? Paracetamol, because one of the most common causes of liver damage is alcohol. And we also have enzyme inducing drugs like rifamycin, carbamazepine, and phenytoin, And we also have herbal product. If you know that you like combining herbal products with medicine, with drugs, avoid herbal products when you are taking herbal and when you are taking paracetamol. Based on the research on paracetamol and why it has caused most of the hepatotoxicity, based on the research report from Nigeria Health Authorities, NAFDAC, and academic studies, we found out that paracetamol poisoning is one of the major causes of acute liver failures in Nigeria and around the world. In a report from the Southwest in Nigeria from 2013 to 2017, we found out that liver-related disorders cause about 138 deaths, almost 47.6% death among the admitted patients, and studies in Enugu, a study in Enugu. We also found another studies in Enugu show high rate of paracetamol misuse in children. About 8 givers of caregiver administering it to children, while about 98% of respondents only aware that it causes liver toxicity. Paracetamol is safe when it is used at the right dose, and it is dangerous when it is used more than the recommended dose. Never exceed the recommended dose. And when you are in doubt about the dosage of the paracetamol, ask a pharmacist or doctors. Thank you.